Good afternoon, and thank you for listening again today. As of 2 p.m. today, there have been 6,625 positive cases of COVID-19, including 262 deaths. Over 65,000 Missourians have been tested at this time. As you know, we are preparing to reopen Missouri for business on Monday, May the 4th. Since Missouri's first case, nearly 50 days ago, we have accomplished a tremendous amount of work together. We have issued 7 executive orders and waived or suspended over 450 state statutes and regulations. We have ordered nearly $40 million worth of PPE, and we have significantly increased our testing capacity. We have been approved for our major federal disaster declaration. We have mobilized the Missouri National Guard to further assist our efforts. We have converted a hotel into a hospital in the St. Louis region in just 11 days. On March the 21st, we issued our first statewide social distancing order. And through it all, I am proud of how Missourians have pulled together to help one another during this challenging time. From state government to the private sector to everyday citizens, Missourians everywhere have stepped up to do their part. It is because of these efforts and working together that Missouri is in a better place, so we can move forward and bring back our economy. We have drastically improved the predictions for Missouri, and we are moving forward with our plan to reopen the state on Monday, May the 4th. Today, I am extending the emergency declaration in the state of Missouri through June the 15th. Now, I want to be clear, that is not an extension of the stay-at-home order. We will be reopening Missouri on May the 4th. Extending the emergency declaration simply allows us to continue utilizing our resources and deploying them around the state. This also enables us to keep all the waivers or suspensions of state statutes and regulations in place while we adjust to the reopening. We know there have been a lot of questions about what the reopening will look like. Next week, we will officially introduce the reopening plan, which will take effect on May the 4th. Some of the items that we will address include guidelines for small and large businesses and retail manufacturing, a plan for restaurants to reopen, businesses such as barbershops, hair salons, and gyms, as well as other jobs requiring people to be within 6 feet of each other. We also have guidance for attending church services, per conversations with religious leaders across the state. We are also working with DESE to hopefully develop a process for senior graduation. Events such as weddings and outdoor functions will also be addressed. We know youth and summer sports and other outdoor activities will also be a question, and we will be addressing that as well. While we gradually reopen the economy during this first phase of our plan, it will still be important to maintain certain measures of social distancing to protect both ourselves and others. Every community across Missouri has been affected differently by COVID-19, some worse than others. That said, some communities will be able to reopen at a faster rate than others. If local leaders decide additional measures should be implemented, they may add to the current guidelines. We know there will be more questions in the coming days, and we will be releasing information on a daily basis. But I want to be clear that none of these decisions have been made by alone. From the start, we have been in constant communication with leaders at the federal, the state, and the local levels to develop our recovery plan. We have also received input from our hospitals, our healthcare providers, public health experts, emergency personnel, mayors, county commissioners, religious leaders, businesses, and employees across the state of Missouri. This has been a group effort, and I want to thank everyone who has provided their advice and their expertise through this process. Kelly, let's go to questions.
Thank you, Governor. The first question is from David Lieb, Associated Press. When the statewide stay-at-home order expires and more people return to work May 4th, do you intend to continue to order limitations on group gatherings?
We will have orders on social distancing that we will. Those numbers will be decided on per individual, per basis, but we will have social distancing as a priority in this order.
All right, this question, thank you, Governor, is from Sean Hertzberg. He asked, this is 41 Action News, if an employee feels unsafe returning to work once the stay-at-home orders have been lifted, are they still eligible to receive unemployment?
Well, was that referring to a state employee or employees as a whole?
It just says if an employee...
Mm-hmm. Okay. Let me just address the employee situation. One, that's going to be between the employee and the employer to decide whether that's safe. That's a discussion we're having right now, and probably will be a further discussion on how we're going to address those issues, because we know that problem is going to exist again, but that's something that's an ongoing conversation that we'll have here at the state.
All right, thank you, Governor. This question is from Rudy Keller, the Columbia Daily Tribune. When will personal care businesses, and you touched base on this just a little while ago, but when will personal care businesses such as hair salons, barbershops, massage therapy, and personal training be allowed to resume?
They'll be able to go on May the 4th. They'll be able to open up and go to business on May the 4th.
Obviously, Governor, you can't have social distancing while you're cutting someone's hair, so how do you expect that to happen?
Yeah, I think there'll be safety guidelines put in place for that, whether it be protective gear or there'll be a guidance for that, how we'll do that. But again, I think a lot of these things, I don't think you're going to need government to regulate everything about how you run your business. I think, number one, the business will take it upon themselves to make sure the customers feel safe. And frankly, the customers are not going to go there if they don't feel safe. So I think it's going to be a combination of the businesses and those customers are going to understand right away what's that comfort level they feel to go out and do business with them. But I think there'll be some guidance that we'll give as far as what they should maybe have for protective gear to protect themselves and the customers.
All right, thank you, Governor. This question is from Ashley Bird. Governor, you said yesterday that you're only concerned about Missouri and the reopening and cannot be concerned about what other states are doing. However, we are bordered by and share workers with 8 other states. We could get a surge because of high rates in Illinois, for instance. Why are you not concerned about that?
Well, first of all, my job is to be the governor of the state of Missouri, and governor's the one thing I'm going to focus on. We're aware every day what the other states around us are doing, whether it's Nebraska, Oklahoma, Kansas, Illinois, and the others, Tennessee, all the ones that border us. We know what they're doing. Basically, on a regular basis. We talk to them one, and then we see what they're doing. But, we're in a unique state, as diverse as we are with St. Louis, Kansas City, sitting where they are sharing borders. But at the end of the day, you still got to take care of the state of Missouri. And again, I'm looking at the data that affects the people of this state of Missouri, and that's how I'm going to make my decisions.
All right, thank you, Governor. This question is from Brian Kaler, Word and Way. Governor Parson, on Good Friday, you brought 2 Christian pastors up during your daily briefing to offer devotional thoughts and prayer. You had no rabbi here for Passover or any other Eyoms yesterday to start the Ramadan. Are you concerned your preferential treatment during these briefings suggests an official endorsement of one religion?
Most certainly I do not, nor was that ever the intention of why they were in here that day. They were basically here just to show that faith plays a big part of who we are in the state of Missouri. No matter what religious domination you're associated with, the simple thing was that to bring faith. It wasn't a matter of who got to be here and who didn't. It was just a matter one, I wanted to make sure that people understood how important faith is in all venues in the state of Missouri, how that is. We are on a weekly basis, we're on a conference call with the clergy and the pastors around the state of Missouri. Before the coronavirus, we actually had meetings monthly with religious leaders around the state that come in from different denominations and different beliefs. And I think it's important for the state of Missouri that we make sure and maintain that faith base in this state, and everybody has the opportunity. But the only reason those two were there was a matter of timing. They were here, and they were able to be here and be part of the briefing that day, but no particular reason because of one faith or another.
All right, thank you, Governor. This question is from Jeff Bernthal, Nexstar. Today, the Senate Minority Leader released a statement calling for additional safety protocols to be taken as the Capitol opens back up to the public for the remainder of the legislative session. He believes anyone entering the Capitol should undergo testing to prevent spreading of the virus. Do you believe anyone entering the Capitol next week should be tested for COVID-19?
Well, first of all, they have the authority to kind of set the stage of what that screening is when they come into the Capitol. They set that the last time they was here. The legislatures do. We have a screening process where we take temperatures and we ask people questions when they come in the door. I think that's something that he would need to take up with his colleagues about how they want to enter the building. But right now, I think there's a safety process in place for people coming into the Capitol.
All right, thank you, Governor. This question is from Brent Martin, KFEQ, Eagle Radio in St. Joe. When COVID-19 outbreaks in Saline and Montauk counties, and now cases cropping up at the Triumph Foods in St. Joseph, what concerns does the state have about its meat packing industry, both safety at the plants and the industry's ability to continue through this pandemic?
Well, number one, it's a huge concern of the state here. One, because it has to do with the food supply chain of not only our state but our country. So we're very concerned anytime we're seeing those issues. I think, again, it's like we've said in the last week or so, and one of the things that we're getting much better at, to have the ability to go out and what I want to call target testing, or basically for these hot spots around the state that we can go in and test. That's exactly what we did. When a couple of the processing plants had a little bit of problem there, we were able to immediately go up there and frankly test as many people as we need to test in those. And again, that's why that is so important, to be able to get out in front of this so it doesn't expand so it gets worse. So I think we're well aware of that. We want to make every safety precaution we can for the people that works in those plants, because that food process, we got to make sure those food lines are open, that we have that ability to be able to get that across the country and our state.
All right, and a follow-up question from Brent. He asked, will these outbreaks at meatpacking plants alter your decision to reopen the state on May the 4th?
They will not. They're no different than any other institution that would be out there that might have an outbreak. The big judgment call to make on that is, can we control it, and do we have the things in place to be able to test and to be able to make sure that we can take care of those people inside those plants that work there and do it safely. But again, we're in the process of doing that right now. We've got the ability to go in there and do those tests, and that's something we didn't have 2 or 3 weeks ago, but we have the ability to do that today, and we are doing that currently as we speak. As a matter of fact, one of the plants, and Dr. Williams might address that more when he gets up here, but I think we are currently doing close to 3,000 tests, if I'm not mistaken, but I'll let him verify that when he gets up here.
All right, thank you, Governor. This question is from Bridget Lavelle, KY3. Lawmakers are supposed to get a first look today at how much they will have to cut from the state budget. Do you have an exact number you sent over to them, or that you would like to see them cut?
I don't think there's any exact number any of us have right now. I think the number we're utilizing both here in the governor's office and the legislatures after talking, I think the number is going to be somewhere around $700 million that we're going to be looking at. And the last I knew, that's kind of what we were all looking at. So I think that'll be the number, approximately somewhere in there, around $700 million.
Are there any particular areas that you think need focused on when it comes to cuts?
Oh, I think everything's on the table. I'm just telling you, for people that's never went through the cuts that's going to be made, I think you're going to have to go back. You're going to have to look about what programs have been started over the years that really are really in need, I want to say. And then I think you need to strip it down to the point of what is it we basically need to provide as government, and you go from there. But there's going to be some drastic, there's going to be some changes in the budget. It's going to be some tough decisions to be made.
Okay. Have you delivered your recommendations, Governor? Your budget recommendations?
We have. We've taken a look at that, and we've actually probably, I think all essential spending's probably been stripped out of it. The things that we added last year is out of it. So there's a start in the process. But again, it's a process to get that done. So again, it's a matter of working with the legislators to figure out how we come up with that $700 million.
All right, and Bridget has a second question for you, Governor. We were listening Wednesday when you mentioned the editorial from the St. Louis Post during Wednesday's news briefing, but we since then cannot find anywhere where that article is located. Can you tell me a little bit about your thoughts on that? Yeah,
you just need to read the article. You read the article and see what they address. Look, I don't care whether you live in urban Missouri or rural Missouri. You know, I believe in this state. I believe that everybody lives in this state. But when you start to basically just be disrespectful to certain portions of this state in rural Missouri, and I believe that total article was exactly that. And I think anybody that reads it would determine that. When you're talking about people in rural Missouri don't understand the coronavirus or they're going to man up somehow and defend this, you know, those kind of words and those kind of things being said are totally uncalled for. They're totally disrespectful, and they were geared for people in rural Missouri, even to the point, you know, and I've lived a life. That's my family comes from Missouri, and I feel like I'm a Missourian. But I never did know I was a governor of different segments of our state. I believe I'm the governor of the state of Missouri, and that means St. Louis, Kansas City, rural Missouri, and every other town in between. And I'm telling you, when you attack those people of this state, I'm going to protect the people of Missouri is what I'm going to do, and I'm going to stand up for them, and I'm just not going to – it was just totally uncalled for, and if you read the article, anybody can figure it out.
All right, a follow-up question from Rudy Keller on that. Do you think, Governor, that you owe the paper an apology?
No. What's the next one?
All right, thank you, Governor. The next question is from Jacqueline Driscoll, St. Louis Public Radio. Governor, the Illinois governor announced he was extending the statewide stay-at-home order for the rest of May. Your goal is to get most businesses open by May 4th. What does this mean for the St. Louis Metro East region?
You know, what they do in Chicago or what they do in Illinois is not my concern so much as far as taking care of Missouri. And I'm going to take care of St. Louis and Missouri, and that's what I'm going to take care of. I'm going to work with the mayors there. I'm going to look at the county up there. I'm going to look at the city, and we're going to try to provide those services. But I'm not going to base my decision on what's happening in Illinois for my state of Missouri.
All right, thank you, Governor. This question is from Daniel, KMOU. He asked, with the guidelines you're putting out for reopening the state, are you concerned about local leaders not following them and reopening too soon? And if so, how can we prevent that from happening?
No, I don't think so. I trust the local leaders across this state. You know, people out there know their communities better than what I do sitting here in Jefferson City. I think mayors, county commissioners got to make decisions what's the best for their counties and their cities out in the state of Missouri, whether it's big city or large cities. But again, we're going to give the guidance, we're going to give an order, and so far I expect people to follow the orders until that time.
All right, just have a couple more questions for you, Governor. This question is from James Klein, Dario Digital. Governor, with most of the state's resources being directed at COVID-19 response, how much of the state's government will you be able to open up on May the 4th?
You know, we're going to open up the government in phases just like we're kind of opening up the economy. However, I think it's important to realize when you say open up government, the majority of state workers, the majority of all state government has been running ever since the first case of this, the first time we had this situation. But when you look at our larger agencies, Department of Corrections, for example, public safety, mental health, all of those are a tremendous amount of employees in state government that's been at work every day and had to go into what I want to say to the front lines every day. So we're going to put people back in there. We're going to make sure people can conduct their business just like we have been since this virus started.
All right, and a follow-up question from James. Is there a plan to implement long-term measures to keep Missourians safe after opening?
Most certainly. I talk to Dr. Williams about that every day. I talk to my senior staff here, and we talk about leaders, all the directors that you've seen here before making presentations with me on a daily basis. We realize that we're going to have to do both, and this virus is not going to go away. It's going to be here, and we're going to have to deal with it. So it's a matter of making sure we got a plan, and we're prepared for when that day comes. And I think we do at this point. And the reason I believe that so much is we finally have got the data and the resources to know kind of where we're headed in this state, how to be able to go out and target such areas, how to have the testing available to go out there and make sure we can get people in a safe environment as soon as we can. We also look at things like the hospitals, the ICU beds, ventilators out there. What is the trend of where we go in the state of Missouri? And if we do have these areas that we have spikes, which we will, are we prepared to handle that? And more importantly, is the healthcare system prepared to handle that? And right now, I firmly believe we are, and I believe we're going to be able to do both, and we're going to move Missouri forward.
All right, Governor, this is the last question from a reporter. Madeline McLean, KQTV. Who has the authority to shut down the processing plants down Is there a threshold of confirmed cases before the state will order a plant to shut down?
Well, there's a number of ways it could be shut down. I mean, the USDA could shut it down, the Department of Agriculture could shut it down, the Department of Health could shut it down, so there's different avenues you can shut a plant like that down. But is there a certain amount of people that would get COVID-19? I think that's probably what the question is. Or do we shut the plant down at that point? No, there's not a certain number out there, but again, that's why we move in so quickly to make sure we don't have that problem. But again, that's a private business, a private sector, and the only way we would do that if there was some sort of violations in there, or we truly thought it was the safety for everyone in that plant, or for food safety, either one of the two.
All right, and the final question from Madeline for you, Governor. You and other state officials have said repeatedly that keeping the public informed is critical to contain the spread of COVID-19. Have you urged large manufacturers, producers, and employers like Triumph Food to be more transparent with the public about positive cases?
Yeah, I think we all know that pretty good. I think Director Williams has did a good job of that. I mean, we pretty well know in the state when we have a hot spot, whether it's a nursing home or whether it's a business or whether it's certain counties or certain cities. We're putting that information out daily, trying to make sure people do know where there's at, what we can put out, because at the end of the day, it's about public safety. And I think it's one of the reasons we do these briefings, we've done them so long for every day, is to try to get as much information out there, be as transparent as we can. But I think we're doing that in the state of Missouri, and I think the Director Williams, is doing a good job with that. All my directors are that are coming in here with this information. So we're going to do the best we can to keep the public informed. And again, priority number one, make sure people are safe.
All right, thank you, Governor. Next questions will be for Dr. Williams. Dr. Williams, this question is from Lucas Geisler, ABC 17. It's been a few weeks since Missouri has had a 300-case jump in one day. What do you attribute to that increase today?
Lucas, thanks for giving me a chance to explain. You know, the governor has said previously that you'll see these days come in where you see an increase, and people might think, well, that's from the day before. But we had a situation, we put this on our website, where one of our large commercial labs, a national lab, yesterday bundled up a tremendous number of cases from about 10 days and released that number yesterday to us. And so the number you see today does not reflect anything from yesterday. It's certainly not a spike or a surge. It really reflects about 10 days. We also had an issue, Lucas, with mortality, in which one of our entities didn't report over a period of about 12 days deaths. And so you'll also see a number today on that if you were just looking at it and not understand the context, you would think, gosh, what happened yesterday? But again, that was over a period. And the governor's always said, you know, don't look at it day to day. Look at trends. Look at 3 days. Look at 7 days. So I really appreciate you asking that question, and because we've got to get that information out, because I'm afraid if somebody just looked at that, they would think something had happened, and that's certainly not the case. If you look over the average, yesterday's numbers are really not any different. Now, why that national lab had the issue, they say it was technical issues. But again, our expectation is that all cases and all deaths are reported within 24 hours to us at the state.
All right, thank you, Dr. Williams. This question is from Jim Salter, Associated Press. Can you provide details about the rapid deployment testing at the meatpacking plants in Buchanan County, including who's being tested, when, and when the results will be available?
Yeah, Jim, happy to do that. We've spent a lot of time on that this week, as the governor said, because part of our process of reopening the state is to have the capacity to do exactly what we did last weekend in a county with a nursing home and what we're doing this week up in Buchanan County, and I've been in conversations all week with them. So the first case there was Friday. I think we had another case on Saturday, 2 positive tests, and you know there have been 48 meatpacking plants around the United States that have had cases, probably 3,000 people. And so we immediately got involved with that with the local health director, with the plant itself, with the local elected officials, with the doctors. And so what we did was we immediately went in and did some initial testing. I think today's Friday. The first testing we got back on Wednesday, I believe. We have another set of testing that will come back tomorrow night on Saturday that's being done right now. And then we have another tranche of testing, which is about 2,500, 2,800 tests that will be either tomorrow or Monday, Tuesday, and Wednesday. I think we're going to do about 500 a day. It's important to understand that this is comprehensive surveillance testing. We do not have an outbreak there. We have a small number of cases, 12 out of 2,800, in which we are now going in and being incredibly proactive in testing everybody. We're also helping the county with our contact tracing. I cannot thank the physicians there, the health department there. I've talked to the plant manager numerous times. They are doing everything we would ask and have always been doing that, which is taking temperatures, using hand sanitizer, using protective equipment, trying to notify people. And so I've been on the conversation with numerous people, and including elected officials last night. And we'll be involved with that all weekend, to be honest with you. We will stay on top of that in our strategy of boxing it in so that those 12 patients don't spread the infection. It's also not as simple as the plant. People live places, and this is not a living-in facility like a nursing home or a prison. And so they certainly could be acquiring this where they live. And so part of our testing today is looking at exactly that, where they live. So again, a very comprehensive, proactive, getting ahead of this is the capacity that we now have. You heard the governor say 3 weeks ago we probably wouldn't have had that, but now we do, because we've really got now, I think, 17 labs that are working with us doing testing. Can do about 7,000 tests a day if we needed to. Now, again, as people become less symptomatic, we don't need to do as many tests on a day-to-day basis, but we increase that capacity to do exactly what we're doing. But thanks for the question.
A follow-up for Jim. Where else is similar rapid deployment testing being planned?
Yeah, Jim, we're looking at all our meat packing plants. I was on the phone today with different people in Montauk County and Saline County. We'll be going in next week and doing similar things. Now, some of those plants have already done it in Saline. So, but we're looking at another one, and we're also looking at that county. And I'm also looking around the state. Chris Chin, the Director of Agriculture, who's been a great partner in this, she was on a conference call today with Iowa, where the most meat packing plants in the country are, to look at strategies going forward to do what we call sentinel or surveillance testing in those facilities. So we'll be in the 2 counties I mentioned next week, and then we have the other ones that we're looking at.
All right, thank you. This question is from Sebastian, KBIA. He has a few regarding the meat processing as well. Will the state be conducting mass tests at meat processing plants that haven't had confirmed cases, or only where someone has tested positive?
Sebastian, that is not our plan at this time, but we want to be prepared to do that if we need to. And I spent some time this morning and look at them to see where that testing. So much of what we're doing now is matching up our capacity to a place, and you've heard the governor talk about the ability to be nimble and move things around. So I spent some time this morning looking at just that. But at this time, we do not have any plans to just go in to a place that doesn't have any positive patients, but would want to be able to just pull that off the shelf immediately and be there the next day if we needed to.
All right, what machines is the state using for rapid testing as part of its boxing in strategy?
Yeah, we're using the Abbott ID machine. Those were given to us by the federal government, and we're getting cartridges. We are waiting for more of those to roll that out in a larger way. There was a question to me, just to follow up earlier, about a possible false negative rate of that, of 15%. A media outlet reported that. And we have looked into that. And again, if you don't use the medium, if you just use the test and the cartridge, we're very comfortable with the sensitivity and specificity. That's a very accurate test and gives you the result in 13 minutes. We put out a press release yesterday. We have those situated all around the state to increase access to our providers so we can tell them immediately within 13 minutes, and also in rural areas that haven't had as much testing.
All right, and Dr. Williams, if there's a large outbreak confirmed at one of those plants, do you think the state will place additional restrictions on that area affected?
Well, what we usually do in that case, we would go in and look at maybe different strategies to mitigate. So if we get more cases, because we're going to be testing 3,000 people, we will look at those cases. We look at where in the plant they are. Is there a chance they're coming from home? And so we look at that very carefully, and like I said, we'll be on that all weekend and watching that. So we try to be, as we've always been throughout this, very scientific, data-driven. Where were the cases? Talked to the plant manager this week for the 12 cases they have. Is there a pattern there that we need to be in tune with? And again, they've been incredibly responsive, and can't thank them enough for cooperating, as have the doctors. We've had some phenomenal doctors up there help us, and at two of the large health systems up there, Northwest and Mosaic, and so really appreciate their help.
All right, thank you. This question is from Philip Sitter, Jefferson City News Tribune. Doctor, much of the attention recently has been on testing and PPE, but are there any issues because of the pandemic with the availability of other healthcare items such as antibiotics, cancer treatment drugs, insulin or emergency room medications, and equipment for cardiovascular issues, overdoses, and trauma? If so, are those issues also being taken into consideration of evaluating the healthcare system's capacity?
Philip, that's a really good question. And so we've talked with Herb Kuhn at the Missouri Hospital Association and Jeff Howe at the Missouri State Medical Association. And I'll be on the phone tomorrow. Every Saturday morning I talk to all the doctors in Missouri, and then right after that the governor and I talk to the infectious disease doctors throughout Missouri. At this point, while there were some issues, concerns back in late February, I think, about supply chain for drugs and things like that, we're not seeing that to any capacity to hinder reopening up at this point. But again, we will watch that. Now, you're hearing of some hospitals opening up now to do elective surgery, and we think that's fine. But as they do that, it is their local responsibility to make sure that they do, in fact, have all the drugs that one would need to do that. That's part of their responsibility. But we will continue to assess that, as I know they will too.
All right, thank you, Dr. Williams. This is from Jacqueline Driscoll, St. Louis Public Radio. Dr. Williams, it appears that the amount of COVID-19 tests the state is completing on a daily basis is trending downward. Is that due to a lack of tests or fewer people being tested? Jacqueline,
it's really simple. It's fewer people being tested. I mean, we have the capacity to go in and do 3,000 tests in one place in one day. So that's just not the issue. It is that, in fact, there are just less people walking around who are having fevers and coughs and have the flu and other things. So those 90% of tests that we were doing 3 weeks ago that were negative, we're not doing now. But the important thing about that is that it really helps us build our capacity, as the governor has said, to go in, and whether it's a nursing home or a meatpacking plant or a behavioral health place, go in very quickly, or maybe just a community, and very quickly do rapid testing. I would just add, somebody called me today, and I think at this point in Missouri, if you have a fever and a cough, I would be concerned about that, and I would get tested for COVID-19. So I don't want to leave anybody the impression that they're not people just walking around who could still get community transmission. That certainly is happening. And so this would not be a time to say, well, gosh, I've got a cough and a fever, I'm going to ignore that. No, we would want you to get tested for that.
All right, thank you. Dr. Williams, this question is from James Klein, Dario Digital. Will the new equipment for sterilizing the N95 mask help with the demand shortage for PPE in the state?
James, it will. I can't tell you as a physician how excited I am about that, and just commend all involved for Missouri being one of the first states to do that. When you talk about personal protective equipment, I've operated for 30 years, gloves and gowns are usually a little easier to get, but these N95 respirators, you just can't turn a light switch on and get those. So, I just can't commend Director Karsten and the governor and everybody on behalf of doctors throughout the state and nurses for getting that. We'll be 85,000 a day, and I think they can be, I think it's 20 times with that modality. I think the governor and I are going out and visiting it next week. It's just, really exciting to have that technology and to have it going forward, because, as you can imagine, to extend the life 20 times as opposed to having to go out and buy it, is just a great example of kind of the innovation and ingenuity you've seen across the cabinet and across the governor's office as we've looked at new ways to deal with something that is essentially unprecedented. All
right, and the final question for today. Dr. Williams, this is from Megan Smaltz, KRCG. Will the state be reporting the number of patients who have recovered from the virus now that the state's testing capabilities have vastly increased?
Megan, thanks for the question. I have to tell a little story. I hear a report every day about recovery rates for the state, and it has really been a goal of mine to find that out. So I called that particular state 2 days ago. I'm friends with most of the state health directors. And the number that is given out every day is not like deaths, and it's not like a number of cases. It's an extrapolation. It is a using data to come up with an idea. So we certainly, now at a local level, Boone, Callaway, Cole County, I see that on the news every night. But as a state, it's just much more difficult to give a hard number for recovery rates. And so for this particular state, which they give every day, it is an extrapolation, meaning they're coming up with their best idea of what it is as opposed to a hard number. But if we were to extrapolate, we would say that 80% of COVID-19 patients have mild symptoms and recover. There's probably a larger people who are asymptomatic, and they obviously do fine. But the number we're using is about 20% will end up needing more care, whether it's oxygen or hospitalization, and then about 6% of those will need a ventilator.
All right, thank you. Governor?
Thank you.
Dr. Williams, just a clarification on that last question. The total number that I present every day, such as today we had 65,000 people and we had 6,625 positive, that number does not include the people that come off. Is that correct? Yes. That's correct. So I think one thing, that number keeps going up every day, but the numbers where people get removed every day is not in those numbers that you hear me say up here every day. So a large number of those people could already be off of that list. We just don't have that information to put that in front of you. So I think that's important for everybody to remember that. We know that COVID-19 will be around for a while, but we must still be able to adapt and to move forward. This means finding ways to manage this virus while still keeping Missouri safe and opening our businesses. But at the end of the day, it's going to come down to taking responsibility and doing the right thing to protect yourself and others around you. We know that this has been hard for everyone, but we greatly appreciate Missourians' patience and their efforts during this trying time. We will survive this, and we will open up our state, and we'll be able to do both, and we'll be better off in the days to come with what we've learned from this virus and learned about how we're going to open this state up and we're going to get business and life back to the way it used to be. Thank you, and God bless.